In dentistry and also in oral health, we most people know that most individuals have 32 teeth, plus or minus, right? But today we're going to have 32 questions. This is in our video episode where we talk and ask questions that highlight different dental specialties and also dental disciplines within the profession, so that you all can gain some additional insight as to life as a practicing dentist or a healthcare professional, maybe a resident in training, but also as a dentist here in the U.S. So we're going to ask some questions and you're going to listen. First question, what's your name and where are you from?
My name is Dr. Julia Jackson. I am from Philadelphia, born and raised.
Philly, represent the city of brotherly love and sisterly, what was it, sisterly affection?
That's right.
There we go.
215.
There you go. Or 267.
If late.
267.
Yes.
Yeah, as of late.
215.
That's right.
Mhm.
Yes. So what's your specialty in dentistry?
I'm an oral and maxillofacial surgeon, the pinnacle of dentistry.
And how long have you been providing care as an oral surgeon?
I finished my residency in 2011, so I've been providing care for over a decade.
Yeah. And where did you go undergrad? And what was your major in undergrad?
So being born and raised in Philadelphia, I went to high school in Philadelphia. I went to middle school in Philadelphia. I have a younger brother who's from Philadelphia. And my mom and I did all the college tours. We went to different universities and figured out that it would be best for me to be in a university that was small so that it could be a nurturing environment. I ended up picking Wesleyan University, which is in Middletown, Connecticut, a small liberal arts college. Sometimes they're called a little Ivy or a small Ivy League institution. And I was a psychology major, and I think it was one of the best moves to get me into the open mind of education.
And the open mind of people that we serve as well, right? How they make
Absolutely.
decisions, what they're thinking about, all
Absolutely.
very helpful in understanding and learning that.
Absolutely. I think an educational institution just kind of gives you the structure and the boundaries of where you feel comfortable, and sometimes opening your boundaries and figuring out, hey, maybe I came in to be a doctor, maybe I came in to take the pre-med prerequisites, but I'm not going to limit myself. I'm going to take psychology, I'm going to take sculpture, I'm going to take architecture, I'm going to take different courses to open my mind, still being in the confines of an educational environment. College is the best.
Would you say that third molar extractions is probably the most common procedure that most oral surgeons will do, or is it something else?
Yeah, third molar, or just taking out a tooth that can't be fixed. Because we take out teeth. So if you think about it, third molars are going to be predominantly like 16, 17. I take out third molars on 22-year-olds, but there's a whole plethora of middle-aged people who need a single tooth removed. So it depends on the practice, to be quite frank, Dr. Darwin. It could be third molars, but I'll just say simply extractions are the most common procedures that oral surgeon would do, depending on the oral surgeon. There's probably an oral surgeon who repairs cleft lips and hasn't taken a tooth out in 15 days or 15 years. So it would depend
because they
on
specialize within the specialty.
Absolutely. I don't treat TMJ. So maybe you're speaking to another oral surgeon who says, oh yeah, this is my bread and butter, TMJ. I personally do not treat TMJ for my own reasons.
So since we're to start talking about cases, give us an example of one of your most memorable cases or procedures that you did that gave you like exhilarating feelings ever as an oral surgeon.
I believe that feeling is not just my own egocentric, happiness. It is when the patients are happy. It's the patient's response is what gives you the most joy. I had a patient who came in and she sat down. This was after the procedure, probably like a month or two after the procedure. And she had a bottle of Dawn Perignon. And I was like, what's this for? You already paid for the procedure. She said, nope, I want to give you this because you have changed my life. There was a point when I was wearing an upper denture and I couldn't appreciate the bubbles of the champagne on the roof of my mouth. And now I want you to be able to appreciate it as much as I do. Here. I said, oh. Yeah.
Cheers. Cheers.
Exactly.
Cheers.
Exactly.
Cheers, Miss Jones. Cheers, Miss Jones.
So this was an all-on-4 upper. And when we do an all-on-4 upper, the palatal portion of the denture is removed and reduced.
Yes, hallelujah.
And they don't have to wear this bulky denture that's moving around anymore. So
right, acting their speech.
Those are the things.
Yeah, those are life-changing.
Yeah,
because the first thing that you see too on their face is this.
Yes, patient satisfaction.
Smiling. Yeah, they start smiling like from ear to ear, neck to neck.
Absolutely, just making other people smile now. Because in oral maxillofacial surgery, my job is to make sure that the foundation is solid. So I don't ever really get to see the smiley, happy folks because they got a crown from Dr. Darwin's office or they got a crown from the general dentist, and I never really see the follow-up. So when someone does come back a couple months later or says, hey, look at this now, or they go for a job interview, I did anterior maxillary implants, and the guy felt like he got the job because he had new teeth, those kinds of rewards. When I go out to Arizona, we work with a methamphetamine clinic.
Oh, okay.
And when they're on this clinic, the idea is that you don't want to just rehab the person's mind and get them off of drugs. You want to rehab their mouth so that they can start to feel more involved with the rehab. And so those folks have beautiful smiles when we're done and feel just the feeling of accomplishment again of making someone else happy.
Yeah, Darwin, just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. BBS.
Yes. Oh, yes. Lord. That's orthodontic procedures.
Orthodontic procedures. Is that one of the procedures that's been the hardest or most challenging that you've completed? What's been the most hardest or the toughest, most challenging procedure that you've worked on?
The first tooth I took out in dental school was the hardest one. Just walking into the room, and the one that I remember the most is walking into the room. this was this premolar on the top tipping him back. So
yeah, but you were a dental student. You weren't an oral surgeon.
No.
We want to hear about the oral surgery ones.
I was in the oral surgery department. So, I mean, that was the beginning, the bud of me, and my passion for oral surgery was in the dental school oral surgery clinic. I cannot think of anything that was too much of a challenge. I pride myself in saying I haven't had a tooth beat me yet. There hasn't been a tooth that I haven't been able to remove. There have been some especially tricky ones. Sometimes we have to take out a tooth at the inferior border of the mandible, coming in from the lingual, trying to retract all the soft tissue, get down, way down into the space. If you do end up making it a coronectomy where you just remove the crown and then you could jimmy up the root from the inferior border, it's not tricky. But maybe there's perspiration and you're thinking, my God, is this going to be over? But you get the tooth out.
But the first time you did it,
I've always gotten the tooth out.
Not that you didn't get it out, but I'm sure it was, if it was the first time you were doing something as a resident, granted you observed, you assisted the second years, the third years, the fourth years.
Right.
I'm sure there was one.
Maybe trying to reconstruct a mandible. We have what we call favorable and non-favorable fractures. When the muscles are pulling the break apart is a non-favorable fracture versus if the muscles are kind of helping to keep the crack or the fracture together. I've seen other people's challenges. I've witnessed one time in residency, I remember we all were in the room. We did a whole case. It was very exciting. It was an orthodontic procedure. We took the patient out of the room. Anesthesia was there. Everyone was patting the chief resident on the back. We got to recovery and the patient started coughing and coughing. And we looked and coughing and they had left the throat pack in the throat. And the person wasn't breathing. I mean, I just remember challenges that weren't necessarily my own, but challenges that I will never forget. That person's okay. You know, you're always mindful of a throat pack check because remember, this person shut down with wires. You can't have them shut down with wires and the throat pack behind the shutdown. So
somebody missed a step on the checklist.
Right. But I can't. There's nothing that I can think of.
You just named two though. That was good.
Okay.
Because those lingual version extractions that are partially or completely impacted that innervate or touch near.
Yes.
And
the inferior border of the Yes. It's the ones that my assistants say to me, Dr. Jackson, why are you taking this tooth out? It's the ones where other people are like, well, why are you doing this? This is entirely too difficult. And I say to them, that's why they sent them to us. So
you should have told them, as an oral surgeon, I am the alpha and the omega. Exactly. I am the beginning.
Exactly.
I'm the expert in the beginning and the expert at the end. As in, I get the referral at the beginning and I get it at the end when there's a problem.
Oh, exactly. But see, that's the ego there. It just blows it right up. I can do anything.
Right. There you go. Now you can get in contact with Dr. Jackson, Dr. Extraction Jackson, Julia Jackson, and get some more information about some of the services in her office, but also some of the education that's out there. And if you have questions, just more about oral surgery and becoming an oral surgeon one day. So, been very good. Now, next good thing that you can do is go to the next video. Go to the next video. There's a whole bunch of a lot more stuff going on over here and over there. Go to the next video. Go.
Thank you.